begin tonight with our Your Health segment. Tonight, the Frontline Perspective. Your chance to ask questions of the medical professionals whose jobs have become so much riskier with the arrival of the coronavirus. Joining us as part of Healthcare Heroes Week are Heather Brock, emergency department nurse at the University of Maryland, Baltimore Washington Medical Center, and Dr. Amit Chandra, chief of emergency medicine at the University of Maryland Medical Center Midtown campus. Amit and Heather, thank you for being with us. I'd like to start by saying what everybody watching would like to say to you, which is thank you. Thank you for doing your job. Thank you for putting yourselves at risk. Thank you for taking care of people. You know, I'm sure you've seen all of the expressions of public support, the flyovers and the signs. How does that make you feel?
Honestly, to me, walking into the department every day and seeing, the big signs that Maryland has put out for us, and then being provided lunches and masks and hats by the community. To me, with everybody having such a hard time, the economy having such a hard time, and these people are just giving us what they can just to say thank you. I mean, from the bottom of our hearts, that just, it fills you up. It makes you happy to come and do what we're going to do for the day. It makes you feel appreciated. It's great. I love it. Yeah, that wall Amit, that means so much coming in every day.
That's great. Amit, your perspective.
It's an incredible time to be delivering emergency care here in Maryland and really everywhere. We've always gone into, those that go into the profession do so, I think, quite selflessly, but it has just been outstanding to see the support from our local community, and it is what keeps us going. We are all working so hard right now to understand this disease and provide care as safely as we can. And it is a challenge that we're up to, but absolutely incredible to see the support of our patients, just working shifts. The gratitude that I get as feedback on a daily basis has just it's skyrocketed. And it really makes you feel so privileged to be taking care of people right now.
Let me start with Amit on this, and then Heather. What is a typical day like in your emergency department today, and how does that compare to what it was 2 or 3 months ago?
That's a great question. If you were to walk into our ED, it is a completely different layout than the ED that you would have seen a few months back, and that reflects the tremendous amount of work we've put in to make sure we can safely care for people who come in right now with respiratory symptoms, with influenza-like illness that may have COVID-19, but also make sure we're able to continue to care for our patients that come in without those symptoms, the ones that we need to continue to think about, folks having chest pain, severe abdominal pain, trauma. We're ready to take care of everyone. And so in order to do that, you would see a completely different layout where we're triaging people up front to determine if they have respiratory symptoms, and then sort of arranging them safely in a space where we can take care of those folks and take care of the rest.
And I agree. If you walk into Baltimore Washington Emergency Department, it's the same thing. We have our waiting room partitioned off so that our respiratory illnesses, our influenza-like illnesses are on one side, and everybody who comes in with a general complaint will go on the other side. The same thing with our treatment rooms. We have a great protocol in place that we're sanitizing these rooms in between patients. We're trying to keep our COVID-like patients in a specific area. Same thing with all of our ancillary departments, CAT scan, X-ray. They all have their protocols in place that we can make sure that it's safe for people to come and have their testing done or be evaluated by a physician in a safe place and not be exposed to the potential of getting COVID-19.
Let me remind our viewers, if you have a question for our guests, you can email it to us. Email address livequestions@mpt.org. Let me ask both of you about personal protective gear, the masks, the shields, the gowns, from two perspectives. One, do you have access to what you need? And two, the patient perspective on that they're seeing somebody coming at them looking like, they're in an Aliens movie. You're not really seeing faces. You're not having the human contact. Yeah, tell me your perspective on PPE.
So we have been incredibly fortunate to be able to have access to PPE. There's not been a time when I think that I have felt unsafe or not been able to have access to whatever I needed. The University of Maryland, especially my leadership at Baltimore Washington Hospital, has gone above and beyond to make sure that we have everything that we need, that stuff never goes below par. And as far as from the patient's perspective, I haven't noticed any concern. If anything, they're happy that we come in. They understand that it takes longer for us to respond to maybe a call bell because we have to get our gowns on, our masks on, our N95s on. The amount of patience that people have given us has been just tremendous. Like, it's not something that I've had people be worried about or scared about. I feel like we can still show emotion through our eyes and through our body language, and we can still hold the patient's hands. So I think that even though I could see where it would be kind of scary, I haven't experienced that.
Absolutely. I want to echo that. And when we started learning about the pandemic and its arrival, we were planning for the arrival to Maryland, making sure we had PPE that our staff, that we were safe to deliver care, so that our patients were safe was priority number one. And we put a tremendous amount of work into that starting early in this year. Really, I can look back to late February. So we were well prepared, and I'm absolutely grateful to be part of an organization and a system that was able to respond the way it did. I think we think about this pandemic a little bit differently. All of us in emergency medicine are used to some level of risk at work, but now thinking about those at home. My wife's a physician, and we're about to have our second child, and my first is just about 2. So we certainly don't want to be taking anything home. And so that is something that's very important. And we've taken an extremely organized and very data-driven, actually, response. I receive, as part of leadership, a number of reports each morning. And we're having meetings, if not twice a day, to make sure our staff has the gear they need. So it's been really important. And I think what that has let us do is translate that into a very calm environment that our patients, I think, appreciate. And I think that allows us to kind of get away from this alien look that we all, have. And I think they sense the calmness. They sense that we're there to take care of them safely. And in my experience, I think it's been, they've been totally okay with it, and they've adjusted just as well as we have.
Mm-hmm.
Folks, my earpiece has dropped out, so I'm not hearing you at the moment, but I do want to ask you a question from a viewer, which is, I'm 70 years old. As things gradually open up, how do I assess the risk of doing things like getting a haircut or going to a retail store? So I'll ask both of you, with your experience with this disease, what are you telling your family members?
I'm telling my family to assess their situation individually. So if there's something that you have to do, we can't live in our houses forever. We can't be scared of COVID-19 forever. We're going to have to figure out a way to manage this and manage the fear that comes along with it. And if that means that we wear masks or we wash our hands, those are things that we're going to have to adopt into our everyday lives until we get over this, until we come through this. So as far as like telling my father and my father-in-law and my parents, if you have to go to the grocery store, wash the handle of the cart, wash your hands when you come home. Just simple things that we should have always been doing, but now we should really focus on. And I think if you do those things, then your chances of getting this illness is very small.
We want to actually, I think that's great, exactly right. And we want to make sure that we have methods to move forward and continue our lives as best we can. And so I think we all have those decisions to make, and some of them are a bit personal, but I would say that absolutely essential things like making sure you get food, going to the grocery store, we're going to have to learn, we've all learned new ways to do that. And so I think the messaging is the same, right? It's make sure you're
let me ask this. I know in addition to patients coming into the hospital, you have patients leaving the hospital, and the Baltimore Washington Medical Center about to celebrate its 200th discharge of a coronavirus patient. Tell me about those days.
So they play a song over the hospital every time we've discharged a COVID-19 patient or the patient gets downgraded from the ICU. And they've turned it up in the emergency department so we can all hear it. And it's just like a little 10-second dance party. It really lifts your spirits. It really, just to know that we're doing this, like we're getting through it. We're helping people. We're saving lives. The people who are the sickest, we're doing the right things. So every time they play that music, man, it just lights a little fire on you, and you continue with the rest of your day just great.
Yeah, I think, and I just add, it's really what continues to get us through all these moments as we're learning to treat COVID-19 and therapies are evolving, and we're learning more on the fly. At Midtown, we've been able to discharge the majority of our patients who came in with COVID-19, and there's a tree outside where we'll tie a ribbon to celebrate a discharge, and it's really a nice reminder of why we're going into work, and we're putting on all that really heavy gear and taking all these measures to make sure everyone's safe. It's absolutely the reason we do it.
Mm-hmm.
I'm surprised we have not heard more about medical people deciding that they can't risk it anymore. They got to protect their families and therefore are leaving, working in hospitals, maybe finding something else to do. I'm sure you've heard of that, and I'm sure, unfortunately, you probably both know people who have contracted the disease on the job.
I do. I know a few of our coworkers have, but like we were saying earlier, it's the risk that we assume when we go into emergency medicine or even intensive care.
So we have, we've certainly been really, really cautious about our PPE response, and it can be challenging, to come to work and be there to do what you always signed up to do, but sort of in a different way than we've ever envisioned. And, I think it's telling to those that show up to work, and we were celebrating Nurses Week in Healthcare Heroes Week. And I think that is not a term I take lightly, but the response of our group to come into work and a little bit into the unknown. And I want to be clear, at least in Maryland, we've been able to do that safely in terms of the PPE, but even still, that response is very telling of the character of those that we work with, and I'm proud to be part of that. And it's just been really an incredible experience to be part of such a selfless group.
All right, we'll have to leave it there. Amit Chandra of the University of Maryland Medical Center, Midtown, and Heather Brock, University of Maryland, Baltimore Washington Medical Center. Really appreciate your time. Again, appreciate all the great work. Thank you so much.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.